Hi, everyone. My name is Sadie McGuire, and I'm an OT student doing my doctorate capstone project here at Children's Hospital New Orleans North Shore. And today we're going to be covering body mechanics and positioning. So that's anything to keep you and your child safe when you're moving them, and also positioning for your child to promote the most independence and prevent any sort of injury down the line. Before we get started, I really, really, really want to just beg you to please take this pre-survey. If you're on a computer, you can scan it with your phone on the QR code, or you can type in the link at the bottom and you can pause this video and go take that pre-survey. That is really, really helpful in me understanding how impactful this project is, whether it's making any difference or whether y'all just knew all of this stuff to begin with, and we should change it up to be a little more helpful for you guys. At the end of the video, there's going to be a post survey as well. And if you only have enough energy in your body to take one survey, please just take the post survey. That will be the most helpful for me. But I would really, really encourage you guys to take both and do me a really big favor in that department. So if you've taken the pre survey, we will begin. First, we're going to talk about wheelchair positioning because how your child sits in their wheelchair is really, really important. If you think about us when we're sitting at a desk for a long time or on a car trip and we're in a car for hours and hours, we're constantly shifting, tilting to the side, kicking our leg up. All of that is kind of unconscious repositioning for comfort and to keep blood flow to different parts of our body. And when you're sitting in a wheelchair all day, a lot of times kids and adults can't really adjust that way. So it's very important to have them seated in the best, most safe, most comfortable, most preventative way right from the get go. Doing this reduces the risk of skin breakdown, which we're going to talk about in a few minutes. It also improves lung function and breathing ability. So if you hunch over and curl your shoulders forward, lean forward, get really, really bad posture, and taking a deep breath, and then you sit up straight, put your shoulders back, and then taking another deep breath, you can see how much easier it is to breathe when you're sitting straight up. So that's really important that your child's getting enough oxygen to feel energized and ready for whatever it is they're trying to do. They need to be sitting up, sitting tall, secure, not hunched over or leaning. In the same way, that also increases swallowing ability because they're sitting up tall and their muscles are able to work like they should. Gravity can help pull the food down and it reduces the chance of aspiration or choking. Sitting correctly in your wheelchair promotes interactions with your environment and creates a stable base for fine motor skills. And we're classifying fine motor skills as anything they're doing to interact with their world with their hands, whether that's driving their wheelchair independently or pressing adaptive buttons, playing, handwriting, feeding, grooming, anything like that. It's really important that you're sitting in a stable position with your trunk. The therapy phrase is proximal, which means closer to the body. Stability promotes distal, which is further away from the body, mobility. So proximal stability before distal mobility. And that just means that you need to be really secure and feel very safe and sturdy in your base of support, meaning your trunk, before you can be moving around and doing all of this crazy things with your hands. So to promote their independence in tasks like that, it's really important that we look at how they're positioned in their wheelchair. And all of this together reduces the fatigue of your child and increases their comfort level, which is a really important consideration. So when we look at wheelchair positioning, one of the most important things is that their bottom is all the way back in their chair and their pelvis and knees are centered and even. If you are not sitting with your bottom all the way back in your chair, it's going to create what's called a posterior pelvic tilt, which is where the top of your pelvis is kind of tilted backwards. It's almost like your bottom is tucked under a little bit. It's the picture on the right side of the diagram at the top. And it kind of forces you to slouch a little bit. Your hip extensors are stretched a little bit and your abs are tightened. And so you're kind of slouched and hunched over. It's really hard to sit up straight. It takes a lot of effort to sit up straight in that position. Whereas if you push their bottom all the way back in the chair, and you can even do this in your chair right now, kind of put your bottom in the back and tilt your booty out and create that little curve in the base of your spine, like the first picture right here. That's called anterior pelvic tilt. And you can see how it kind of just forces you to sit up straight without even trying. And that's what we really want to go for, is that more ergonomic position. And they don't have to fight against so many other forces to sit up straight and interact with their environment. You want their trunk and chest positioned against the back, centered and upright. You don't want them leaning, whether you need any kind of strapping or bracing or supports to prevent that from happening. Um, you can talk to your PT or your wheelchair rep about that. Your head should be in the middle of the body with your headrest at the base, and your thighs should be straight out. They shouldn't be cocked out sideways, tilting in. They shouldn't be tilting down or up, and your feet should be flat on the foot plate. The kind of golden rule is 90, 90, 90. You want 90 degrees at your hip, knees, and ankles. Your elbow and forearms should be supported with armrests. If your child is able to push up on the armrest themselves and use that for weight shifting or help with transfers, you want to be sure those armrests are really sturdy. But you also want to be sure that they're not getting in the way of any of the activities that they're going to be doing. Pressure relief is huge with anyone who remains seated in a wheelchair for a long period of time. Um, the bony prominences from your little butt bone or your elbow, or even devices like orthotics, things like that, pressing in on your skin can kind of block blood flow. And when blood can't get to your skin, it degrades your skin over time, and that creates a wound. And once that wound is there, it's really hard to get rid of. And it also is an open sore that can cause infection and all kinds of problems. Plus, it really, really hurts. And so your child will be much happier without pressure relief, without pressure sores. Some of the risk factors that mean that you really need to keep an extra close eye out for pressure relief prevention is if your child's unable to change positions without help. Um, if they have any orthotics or other medical equipment that's pressing against the skin, if at any point during the day they have damp skin from sweat or other fluids like a diaper, that's a really big risk factor for skin breakdown. If they have decreased sensation and they can't really feel as well what's going on, especially in their lower extremities, like their legs and their bottom, they don't know potentially that there might be some breakdown happening, and it's what's very painful for us, and we're saying, oh, I'm really uncomfortable, I need to switch positions. They're not getting that same feedback from their body, and so the skin is just continuing to break down without anyone else checking. Also, if they have low blood pressure or take certain medications such as steroids. For prevention, it's really important that you check devices regularly. So that's like orthotics or anything pressing against the skin. Anywhere where there's something hard touching the skin, you need to check that really often to make sure there's no redness. And be very proactive, especially if there is redness, and very especially if that redness doesn't go away within 20 minutes after you remove the hard orthotic or device from the skin. Um, you should attempt to change positions every 2 hours if possible, and every hour if the child's sitting in a wheelchair. So 2 hours is if your child's just laying in bed all day, if they're bedbound or they stay in bed when they're not leaving the house. You should change the position every 2 hours, and every hour if the child's in a wheelchair. And the reason why you have to change positions more if your child's in a wheelchair is because there's a lot more pressure. All of their body weight is going down through their bottom, and it's not being distributed throughout their whole body like it is if they're lying down in bed. And so it's a little more risk for pressure sores. So if they're in bed, you can roll them around in bed, tilt them up, tilt them down. If they have the tilt function on the wheelchair, you can also do that. Teaching a child who's older and able to understand how to weight shift and lean over to one side and lean over to the other side, lean forward, and maintain that position for several minutes is a really good way to do pressure relief, but you can also help them with that if they're not able to do it themselves. Um, Pressure relief cushions, which that's what the picture is here, is a Roho cushion. Those can be really helpful if your child is at risk for skin breakdown, but speak with your provider about which cushion is best before you go out and buy one, because they're very expensive and some cushions can make it worse just depending on your child's specific condition. And the most important thing is to perform regular daily skin checks and be so thorough when you're checking their skin, especially those areas under clothes and underwear where it's harder to see, but is so important to be checking that and looking out for the early signs of pressure sores like redness, irritation, sensitivity. All of that can be a sign that you need to take action before it gets worse. So now we're going to move into talking about transfers. And before we talk about transfers, we need to talk about your base of support and your center of gravity. So, your base of support is how much area you have under your body to keep you stable. So, this picture on the left of the guy with the red shorts, his base of support when his legs are or his feet are touching is very narrow. Whereas when his legs are spread a little farther, his base of support is wider and he's going to be a lot more sturdy. So if we were in person, I would have everyone kind of stand up, put their feet together, and push on each other. And you're going to be really wobbly and you're probably going to have to like jerk your foot back to stabilize yourself. And if you spread your feet out and kind of get that squatted, light squat position and someone pushes you, you're not going to go anywhere. You're going to be very, very stable. And so that's important to consider when you're transferring is you're holding a lot of weight that's not your own. And when your base of support is too little, it's going to be really, really easy to get unbalanced and make corrective movements that could cause injury. You could fall, your child could fall. You really want to pay attention to your base of support. Your center of gravity is also where all of those forces are combined in your body, and you want your center of gravity to be centered over your base of support. So, usually that's about your belly button, but if you add weight like a child, it's going to move that center of gravity out. And so, when you're transferring things and people, you want to be sure that you're keeping them as close to your body as possible and making that base of support as wide as you can safely. You don't want to be doing the splits on the floor, obviously, but you do want to have some stability under your feet. So when you lean, like in this picture with the guy with the blue pants, you can see that his center of gravity is leaving his base of support and he's becoming really unbalanced. And especially when you have a child who's wiggling and squirming, that is a really, really high risk for falls. And anything that you can do to prevent a fall or an injury to you or your child is going to keep you safe. It's going to keep your child safe, and you're going to be able to transfer and take care of them for so much longer. So, taking that extra 1 second to just make sure that you're stable and planted before you transfer is going to help reduce the risk of injury a lot. So, to transfer, and we're talking like bed to wheelchair or chair to chair transfers. And I will say, at the end of the PowerPoint, there is a link that will take you to a Google Doc that has tons of more resources about all these things that we're talking about. And there are also YouTube videos of people demonstrating how to do a safe transfer. And please, please, please watch those because it's so much easier to see the correct technique than to sit here and me try to verbally explain it. And so take the time to watch those before you transfer your child next time. So when you have a safe transfer, it prevents injury, reduces the fatigue and strain on you and your child, and you can use your muscles super efficiently and save your energy for more transfers. So you want to make sure that the chair, and we're just going to say chair and bed for the purposes of this example, you want to make sure the chair and the bed are at 90 degrees from each other and bring them as close together as possible. There's no point in having to pick your child up and move them 3 feet over to their chair. We're just going for picking them up and pivoting them around and sitting them back down. That's using your muscles effectively and using your energy thoughtfully. So make sure that they're kind of scoot them up and get them seated on the edge of the bed or the chair. You can kind of use little rocking motions at their hips so you don't have to pull them. And if they're leaning forward towards you, you can kind of use their momentum to pull them up into a standing position. Even if they can't help you with their legs, having them lean forward just creates that momentum to stand up and turn to the chair. If they have a chair with arms or a harder chair that you can get them into when they're sitting, that's easier to get them back out of, but that's not always possible. It's just something to think about when you're seating them in a chair temporarily, things like that, that a firmer surface is a little easier to transfer out of. If the surface is raised, if the chair raises or lowers, if the bed raises or lowers, it is so important that if that function is there, you raise the bed or the chair to be at least level with the surface you're transferring to. Um, if you can make it go high to low, that's good. If you can avoid transferring from a lower surface to a higher surface, that is the best thing possible. It's not always possible to avoid that, but a low to high transfer is going to be very difficult and put a lot of strain on you. So keep your feet shoulder width apart, with one foot slightly in front of the other for stability. You can use your feet to block your child's feet from slipping. You can see in the picture, it's pretty visible on step 3 and step 4 how he's kind of got his, I guess that's his right foot blocking the person's left foot. Um, because if a person can't use their feet to help you transfer, their legs could really easily slip out from under them. And if you block their feet, it just kind of helps you lift them up to a standing position a little easier. When you pull them up, you want to rock them back and forth and then lift up. You don't want to just yank and pull. And what's really important is to bend and twist with your legs. So, how this person in the diagram turned to the wheelchair with their full body, and it's not just their torso twisting, that is going to really prevent a lot of back pain and back injury. If a transfer is too hard and it's in too awkward of a situation, or your child is in too awkward of a position, just ask for help if you can, even just someone to spot you and be there if something goes wrong. There is never a reason to not ask for help if help is there. Sometimes there's situations where there's no help there and there's nothing you can do about that. But if help is there, ask for help. There's nothing wrong with it. And it could save your back from injury, your child from injury. And it's just really important. So when your child is rolling in bed, you want to raise the bed if it's a bed that goes up and down to at least waist height. There's no point in bending over and hurting your back when the bed raises up to a comfortable level. Get as close as you can to your child. If you have a slip sheet or you can brace a knee on the bed to bring yourself closer, you don't want to put both knees on the bed because then you're back in that hunched over position. Um, but that getting them as close as possible to you goes back to that keeping the center of gravity as close to your base of support as possible to not strain your back. You want to position the arms and legs of your child and roll them towards you. So in the picture that's colorful, you can see the patient has their arms crossed over their body. But in the white picture, you can see that they just have the arm that's going to be kind of like on top, crossed over. Either way is fine, but don't let their arms be splayed out. That's just going to make it harder for you. Roll by placing your hands on their shoulders and hips. So it's where I've put these stars on that bottom picture. Those are kind of your target points for rolling. Don't pull in their arms or legs. That's not going to use your force most effectively and it could hurt them. And you want to shift your body weight backwards versus yanking and pulling with your arms. That's just energy efficiency and injury prevention. When you're taking a child from lying to sitting, you want to bring them to roll to face you and make sure before you roll that you've brought them as close as possible to you. So when you roll, they're already on the edge of the bed. Hook one arm behind their knees and the other one under their shoulders. Um, as you can see in the first picture, they've hooked their arm under their knees and they bring their knees off the side of the bed. And then you put your other arm under their shoulder and one arm on their hip. And you kind of lever them up into a sitting position. If they're able to help push, encourage them to help them push. That's going to be really good therapy for them and also take some of the strain off of you. So anytime that you can get them to do some work to help you, that's really, really important. There is so many pieces of adaptive equipment that you can use to help you with transfers and save your back and save your muscles and energy. The first one I want to say is your child should always be wearing a gait belt anytime you transfer. I know it's tempting to just fling them back and forth, chair to bed, bathroom, wherever. But having that gait belt is really like wearing a seatbelt in a car. It's security, it's safety. If something goes wrong, there's something to grab on to help prevent something super bad from happening. And they have these gait belts like in the bottom left corner that have handles on them that some parents like because it creates kind of better leverage to um, pull up on. A slide board can be really, really helpful. They make slide boards that have a little disc that slides across, so it's even easier than the one in the picture. And there also is a video of a slide board transfer in the links that I talked about. And you can kind of wedge this under their bottom, make a little bridge from the chair to the bed, and just slide them across. And you never have to lift them up. If a child is able to help a little bit, a slide board transfer is a really good option. And talk to your PT or OT about if slide boards are appropriate for your child, but it can be really helpful to prevent having to lift them up all the time. If you do have to lift them up all the time and they're not appropriate for slide board transfer, a Hoyer lift or other type of lift like that can be something to look into. You can lift them up out of their wheelchair, drive the little thing over to the toilet and lower them back down or lower them back down to the bed. The same is true with the Serosteti. If they're able to put weight through their legs, that can be a really helpful device to use. A transfer sheet, if they're under on a transfer sheet, you can it's kind of like a parachuting material and you can slide it backwards and forwards really easily. Never leave them on a transfer sheet when you're not doing a transfer because it is so slippery that they could just roll and right out of the bed or right out of the wheelchair. But it is a really good way to move someone in bed from side to side or rolling, whatever you need. This stand pivot disc is a new device that we just learned about at Children's North Shore location. And if they're able to put weight through their legs and hold on with their arms, they can use this to kind of pull up on the little disc underneath that lady's feet. And then the therapist or you will just simply turn it and pivot it, and they can sit back down. And it's a pretty neat little thing. It doesn't take up a lot of space. It's portable. You can use it in public to go to the bathroom, whatever you need. This is so, so important, but you need to change your habits as your child gets older. How you transferred them when they were a baby or 40 pounds may no longer be safe for you or them. I know you have habits that you've built up and you say, this is the way we've always done things. It's worked for us, but it is not always going to be the safest option as they continue to grow. And I really challenge you to spend your next session with your child at therapy and ask your PT or OT if you can do transfers during their session. That is totally okay. We're always happy to do that. And we can watch how you transfer them, give pointers on how to be safer, and just preserve your health for as long as possible so you can continue to help caretake for your child. And in that vein of preserving your health, it's really important to stay fit and healthy and exercise to protect the muscles that are going to be doing all of that heavy lifting for a very long time. Strength training helps with coordination, balance, bone strength, flexibility, and decreases your fall risk. So, all of those are important in keeping you healthy besides protecting your muscles and things like that. Um, and I know that you probably don't have time to go to the gym. You probably don't have time to do an hour long strength training exercise, even at home. But doing a couple of 5 to 10 minute exercise durations throughout the day can really be helpful. And here's just a few different exercises. There is a website on the link at the bottom as well that shows you how to do all of these. And these are all really good to kind of help maintain flexibility and strength in the muscles that you transfer with. So just something to think about, um, that it's not just transfers that are working you out. You want to work out to protect the muscles that do the transfers. And energy conservation is really important when you're a caregiver or a parent that's taking care of multiple kids or a kid with really high needs. You want to use the 4 Ps. We say plan, pace, prioritize, and position. So plan ahead, see what you need to get, make sure everything's ready and you don't have to be running back and forth. Pace yourself. Don't burn up all your energy at the beginning of the day doing a bunch of crazy things. Prioritize. Sometimes you can't do everything in one day, and you have to think about, well, if I do all of this, my energy is going to be gone at the end of the day. So we need to prioritize some things. And then position. That's getting close to your child, making sure the wheelchair is super close to wherever you're transferring to and from, all those kind of things. Um, Keep items where you plan to use them so you're not running back and forth. I know it might look non-aesthetic, but if you've got you're constantly having to do diaper changes in the living room, leave the diaper stuff in the living room. Don't take them back to their bedroom every time you need to change. Different things like that that can really help conserve your energy and not leave you feeling as worn out and tired and strained throughout the day. Now we're going to move into positioning. And I would just want to mention that this isn't just for when they're awake during the day. This is also for when they're sleeping because kids sleep a lot. And how they're positioned at night matters because that's most of the day. If you only think about the time they're awake, um, you're missing out on a large chunk of the day that they could be positioned correctly. So if your child has a limited range of motion or they don't use a body part typically or normally and they have kind of different movement patterns or they can't quite get all the way to um, extension, which is straightening your elbows all the way out, they can't move certain joints all the way or they choose not to, they avoid the movement of certain joints, then they are at risk of developing a contracture, which is when your all of the soft tissue like the muscles and things in your joints shorten and they just can't they reduce how far you can open that joint. So if your elbow you think you straighten it out and it's a straight line, if someone has a contracture they could maybe only open it out to about 90 degrees and they physically can't move it any farther than that because the tissue has shortened. This picture on the side is the anti-contracture positioning. And so it is the opposite of what each joint is prone to contractures for. So, for example, the elbows are straight out because a bent elbow contracture is really, really common. Um, Internal rotation, turning the toes in or turning the toes out, is a really important position to avoid with the hips. You want to make sure everything's neutral and straight. You don't want you want your palms up if possible because turning your palms down is a more comfortable position and a lot of kids stay in that position, but turning your palms up is a really important movement to have. That's how you open a jar, it's how you feed yourself, things like that, and so you don't want to lose that movement. These are some more positions to be aware of. This is wrist and finger flexion, which is bending your wrist down and curling your fingers up. A lot of kids stay in this kind of curled up position, but as often as possible, get them out of that position, bend their wrist back, bend their fingers all the way out. Elbow flexion, we've talked about, and lower extremity, if it's possible, to get them out of this seated 90-90 position and then their ankles tilting down. Do so because that will help prevent some of the contracture risk of being in a chair all day or being curled up all day, things like that. If you stretch several times a day and hold the joint at end range, which is as far open as it will go, so bending your wrist as far back as it will go, if your child is able to do that themselves and move their elbow straight or move their wrist back or straighten their legs out for you, that is best because those muscles are actively working. But if it's the only way that you can get it done is if you're stretching it for them, then that is just fine too. And like we talked about at night, it's really important. Put pillows around their body if they're old enough to be able to sleep with pillows to kind of block curling up your hands, curling up your legs or arms, and keeping them in a straightened, lengthened position. OTs can also build braces and orthotics for your arms and upper extremities, and you might have braces for your lower extremities. And it's really important to wear them as instructed by your therapist because a lot of times they are prescribing those to prevent things like this, contractures. Also, how you position during play is important. The W sit is a big no-no that a lot of people have heard of. It can result in tightness in hips, knees, and ankles, and it's such a stable position. There's not a lot of opportunity for trunk rotation, and it reduces the ability to cross midline, which is a really important skill for the development of more complex skills later. It's also the position of dislocation, and it reduces rotation and use of both hands. So it's just kind of limiting development opportunities and creating a potential for injury. Ring sit with your legs kind of in a circle out in front of you is a stable position for babies who are just learning how to sit, so they are less unbalanced, and that is totally fine. However, if your child has low tone, which is really common in diagnoses like Down syndrome, they can prefer this position as they get older to such an extent that their legs become really tight outside of that position, and they might have a bow leg gait just because their legs have tightened in that ring sitting position. And so, when your child's playing and you notice they're in one of these positions, you can say, fix your legs, or physically move their legs to be in a more crisscross applesauce position, or put their knees to the side. Things like that are an improvement over these two positions. We talked earlier about how important it is to be sitting secure and sturdy and make sure everything is really safe and upright for feeding. And this helps them to be able to feed themselves a lot better because they have that proximal stability, but also it makes chewing and swallowing safer too. So when your child is eating, take a moment, make sure they're not leaned back in their chair. If their chair has the tilt function, make sure it's straight up, and observe how your child is sitting before you begin to feed them. And that being said, if you have any questions about positioning, body mechanics, or transfers, your PT or OT is always willing to answer them. Please, please, please ask to practice. We would love that. It is so helpful for your child and for you to have someone who's standing back, looking and going, oh, that doesn't look super safe. Let's practice that in a more safe manner. And we have the more information is on this slide for those videos and links to observe how someone is doing a transfer physically. There's several different types: a slide board transfer, chair to wheelchair transfer, things like that. And then please, 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 please take this post survey right here. That is really, really helpful to me. If you didn't take the pre-survey, it's okay. If you take one, I really want it to be this one. And I really need that information to help me with knowing how important this is and how helpful this is. Please, please, please take this. And then I'll go back to the link for the further resources. And if you have any questions, always ask your PT or OT. We're happy to help you.